Hello, and thank you for joining us today. My name is Nikki Holland, and I'm a director at the Canadian Club of Toronto. The pandemic has created formidable change to all of our lives: work, the economy, our environment, healthcare, and urban planning. So today, the Canadian Club has gathered a panel of experts to discuss how we reopen the country and what a safe reintegration looks like. Before we dive into the topic, here's some information about how you can participate with us today. The click here to switch stream button helps if you find that your internet is slow. The video quality may decrease, but the audio quality should remain strong. If you want to send a question our way, click the questions tab, and you can enter a question in the window, and we'll try to get it answered. The request help button, located at the top corner of the page, is for technical support. Thank you today for participating. Thank you today to our sponsor, PwC. We are grateful for your continued support. And let me introduce our panelists. Dr. Isaac Bogoch is an associate professor at the University of Toronto and an infectious diseases consultant for Toronto General Hospital. Jennifer Keesmaat is the CEO of the Keesmaat Group. Jean McClellan leads the National People and Organization Practice at PwC Canada. And Angus McOuat is an associate partner at McKinsey. And of course, today's moderator is Adrienne Arsenault, co-host of CBC's The National. One of the club's traditions that has not changed even in this virtual world is to toast to our country. So I ask you all to please raise a glass. We usually do it in person, but let's do it on the screen, to Canada.
Canada.
Adrienne, over to you.
Thank you. I really thank you, everybody, for being here. I can probably say that one of the traditions of the Canadian Club is not, however, that it's entirely possible that the panelists are wearing pajama bottoms. I'm not revealing my truth here to you today, but thank you, everybody, for joining us. And because this is a chance to gaze into the future, to talk not necessarily about going back to normal, but maybe imagining something better. We're talking about better ways of designing the spaces where we live, where we play, of shopping, and COVID has taught us that we need to innovate fast. And it's had an interesting effect on bureaucracy in that it's sort of erased a lot of the bureaucracies so that good ideas can get to see the light of day. There is a lot of good that could come from this global experience, and so that's what we're trying to get at today. So we will get to your questions throughout the chat as best we can, but why don't we start with some initial food for thought from everyone. I think best probably to start with Dr. Bogoch to give us a sense perhaps of where Canada is in the arc of this pandemic and what in particular is keeping you up at night.
Well, thank you so much for the introduction. I'm calling you from the Toronto General Hospital. Just to, even before we start on the pajama pants challenge, just to show everyone, I'm actually wearing real pants here. I encourage all the others to demonstrate what they're wearing as well. We're going to call everybody out, but you know, a great point. So, you know, where are we right now in Canada? How are we doing so far, and what do we see moving forward? What's keeping me up at night? You know, so far in Canada, we've had about 80,000 reported cases. Sadly, there's been 6,000 deaths so far to date. And of course, those are tragic, and we certainly can do better. How are we actually doing as a country? I know it's very difficult to really think about this while we're hip deep in COVID-19 in Canada. But if we take a step back and if we look at the 30,000-foot view, we're actually doing pretty good. We are not doing terribly. We are doing actually very well. And if we compare ourselves to other comparable countries who might be similar to Canada, we are doing really well. Can we improve? Absolutely. Has this been perfect? Far from it. But we are still doing really well. You know, in April, we were having about 1,800 to 1,900 new cases per day. Now we've improved significantly. We're having about 1,000 to 1,100 new cases per day. Lots of those cases are, of course, in Ontario and Quebec. And of those cases, many and most are actually clustered around the greater Toronto area and Montreal. But the rest of the country is doing very well. What's really keeping me up at night is as we've emerged from the first wave and we're sort of in this lull and we're gradually opening up our economies and gradually lifting these public health restrictions, my real questions and what's really, you know, front and center on my mind is, I'm sure it's on many people's minds, is how can we mitigate a second wave? How can we continue to move forward and do this safely? Do we have access to to the diagnostic testing that we need? Do we have the appropriate contact tracing that we will need? Can we help support people through a 14-day period of isolation if they're infected? And do we have the surveillance systems in place throughout the country to detect any possible cases early enough so that we can jump on those, quell those, and prevent a large outbreak moving forward? And I think, those are the things that are really keeping me up at night right now.
Okay, thank you, Dr. Bogoch. So I think after their health, it's employment that is probably keeping most Canadians staring at the ceiling at night. So Jean, if you could give us your assessment of where we're at with that.
Yeah, so definitely the world of work is top of mind for employers and employees. Over the last number of weeks, we have seen the focus really be that day-to-day focus. But most recently, we're starting to see people look to the future. So employers are planning their return to workplace plans. Employees are starting to think about what life looks like from a long-term perspective. And so we know that health and safety is top of mind, right? So how do we make sure that we are healthy and safe as we go about our work? But then also we know that the nature of work itself has fundamentally changed. So we see virtual working being absolutely prevalent. And so the question becomes, how permanent is that? And then we also have seen that digital skills, whether you've stayed in the workplace or not, have become incredibly important as well. And we knew these transformations and these changes were coming. I don't think anyone knew how fast we would have to adapt because of COVID and because of the situation we're in. But it's a really interesting time from a world of work perspective.
Thank you. Angus, you have some specifics in terms of how people are feeling, consumers anyway. What can you tell us?
Yes, so thanks, Adrienne. I mean, for me, the recovery is about the consumer, right? And when is the consumer going to feel confident that they can start behaving and spending in the ways they did pre-crisis? And we talk to consumers often. We have a panel every 2 weeks we run of Canadians and also all around the world and compare the key differences. And, despite what Dr. Bogoch said, we are actually relatively uncertain and feeling less confident than some other markets. About 22% of Canadians are saying, I feel confident about a recovery, where in the US, that number is 34%. We actually look more like European countries, more like a Spain or more like a UK. And so the impact of this is going to be potentially a prolonged recovery unless we can really get those measures in place, as the doctor was talking about, and really boost that confidence earlier with consumers, because that's when they'll start making those big ticket purchases, shopping the way they used to shop, and allow more people to get back to work as they're spending. So I think our headline is really, yes, the consumer is more uncertain, more unsure in Canada than in other markets, but we have an opportunity to help them feel more confident and really shorten that economic recovery cycle.
Thank you. And Jennifer Keesmaat, I think we've all sort of learned from this, for those of us for whom this is not our area of expertise, that disease often shapes the way we live in terms of the way our cities function and look. And I'm wondering, you must be looking at the coronavirus and then staring at the streets below and wondering how they're going to change.
So let's talk about cities for a second. Cities have already fundamentally changed, in part because we're no longer commuting. And the fact that we're not commuting means that our transit systems are being used in a different way. Our streets are being used in a different way. And many of us are sticking to our neighborhoods. We have layered on top of that the public health requirement for social distancing, which means we need more space in our neighborhoods, whether it's for walking or for cycling. There's really three phases that we can think about how cities are going to adapt and change. There's the right now, which is lockdown. There's the in-between phase, which is before we have a vaccine, but we're getting back to work. We're starting to move around our cities again. And then there's the post-vaccine, which is the new normal. And this really links in very much to what Jean was talking about how work is changing. I honestly don't believe that we're ever going to work in the same way again for a whole variety of reasons. But the very good news about that from a city planning perspective is that, you know, and to use Angus's phrase, the headline from a city planning perspective is that this is the end of the long commute. The long commute simply doesn't need to exist any longer. First of all, we're not all going to be going to work at the same time into the same destinations. Just moments ago, the founder of Shopify announced that Shopify, one of Canada's largest and most successful tech companies, will never again go back to the office. Following in the footsteps of Twitter, the owner of Shopify has announced that the office centrality is dead for working. Well, what does that mean? It means we're all not cramming on transit in a way that we used to. We don't have a rush hour anymore. I believe that many other companies will follow suit, and we'll pick up on that more as we talk about how work is changing as a result of this.
Okay, so let's talk about that. We've had a few questions about that already. Someone asking the question, do you think this actually spells the end of public transit, or will it be the push we need to reimagine it?
This is an important question because we need more space in the in-between phase. We need more space on public transit. We can't jam into transit at 120% capacity as we used to. But on the flip side, we've created dense urban cities that need transit. If everyone got off transit and got into a car, no one would go anywhere. It's a physics problem. There is simply not enough space for people who are taking transit to be getting into cars. It's one of the reasons why we've been promoting transit in dense urban environments. So the challenge we face is that we need to shift the way we think about mobility in cities. And this is where some have been proclaiming that we're on the cusp of a golden age of cycling, because cycling is a form of mobility that can be embraced in a dense urban environment that allows a lot of people to move in a relatively small amount of space pretty quickly. And the vast majority of commutes in Canada are less than 5 kilometers, which is an easily cyclable distance.
So, Jean, let's talk about that news from Shopify that Jennifer mentioned and the loss of office centrality. I mean, I'm in downtown Toronto. I'm looking at a whole bunch of condo buildings here. Behind them are our office buildings that just must be empty shells right now. What is the future sort of physicality of work in your view?
Yeah, it is interesting. What we're seeing from employers, particularly in large office towers, is really thinking about virtual work as a more permanent feature. And it's very fascinating that as we go out and survey the population, that leaders are wanting to return to work and physical spaces, but employees are wanting to work virtually more and more. And there's almost a difference, a tug and pull in that conversation that has to happen. Now, when we think about cubicles and how those are structured, we see employers really thinking about if someone is coming into the office and sitting in a cubicle and not interfacing with anyone during the day, do we really need that particular piece of work? And many are coming up with the answer that they don't. Now, what they do need is human connection and collaboration. And so the focus has been, how do you keep that collaboration? How do you get people to come together to discuss ideas, to work through problems, and do that in a very safe way where we are keeping our health and safety top of mind? And so that becomes the challenge going forward. We see, the real estate side of the house having this tug and pull where we know that from a social distancing perspective, real estate can only be in about 20 to 40% of the capacity that they have had traditionally. But we also see this opposing force of more virtual working. And so, the challenge will be how we come together to work through timing and coordination of how we enter and exit buildings, how we keep our workplaces safe. And the fascinating conversation is that employers and our employees have to do that together, or this will not work.
So, not to throw a spanner in the works, but when you talk about staggering people coming in, is the talk as broad as considering the end of the traditional legislated Saturday, Sunday as a weekend? I mean, are you looking at people's weekends, as it were, being staggered so that you can still get your employees in different shifts?
So there is that type of contemplation. So I think employers right now are trying to hold on to family time and weekends at this particular point, but certainly during hours of the day, they are talking about in-person shifts and coming into the office in shifts, at least for parts of the day, and potentially working remotely for other parts of the day. That is more of the nature of the conversation that I am seeing. And with that comes a big demand on people to be open to that coordination, right? So it's not like you can just stroll into an office tower, into your office at any point in time during the day. Potentially, how you might have made those personal choices in the past. You're going to have to set a time and come in, and there's very much that approach of working as a team. The other piece is there's a huge ability for technology to help in that, right? So from a scheduling perspective, from a hoteling perspective, really using technology to help us coordinate and schedule and work together as a team.
So Angus, thank you, Jean. Angus, there's a question here that seems perfect for you. It says, not all workplaces are offices, obviously. How will we continue with school childcare, other direct delivery person-to-person services?
Yeah, this is a question, especially I spent a lot of time in the retail sector, and retailers are struggling with this question, but actually starting to get over the hump. So groceries have been a category that has led the way on how do we have safe interactions between our employees and between our employees and customers, and having protocols around masks, around direction of movement within stores, cleaning policies. So I think in some ways we can really commend the grocers for showing us what is possible. How can you shop in a safe way and have your employees interact in a safe way? There have been incidents, and they have dealt with those incidents, appropriately. But I think they have demonstrated there are ways to work in service type environments where customers are satisfied, and at the same time, employees generally feel that their health is being monitored and taken care of appropriately. So we're seeing now a lot of other types of retailers and businesses now looking to grocery and saying, how did they do it? How did they stay open through the crisis? What can I learn from them in terms of safety protocols, and how can I start rolling those out over time? Certain, sectors will struggle more. I mean, you think about the restaurant industry, people are talking a lot about that. There is the customer angle, which is, okay, can I only have 50% of my customers in the restaurant? And how do I make money at a 50% full restaurant? But we really need to think about the operations too. And I'm sure all of you have at least seen a restaurant kitchen. It's a hive of activity that social distancing plays very little role in. And how are restaurants going to actually restructure their operations to keep potentially 2 meters apart from each other and not be cross-contaminating ingredients? So big challenges, I think, for industries like restaurants that it's not as intuitive as it might be in, say, grocery.
Thank you, Angus. Dr. Bogoch, an audience member has a similar question to I have, which is, what is going through your mind when you hear all of these people talk about the promise of what is to come? That the audience member asks, do we run the risk of getting too excited at reopening and go right back to our normal face-to-face interactions just to undo all the progress we've made? Does that worry you?
It sure does. I think it's a very realistic fear. And, obviously we're coming out of this first wave in most of Canada. We're coming out of a lockdown. We know how challenging that lockdown was socially, personally, economically, from a health standpoint as well. This was tough on everybody. And I think we need to do a better job communicating that we are not taking a linear path forward by opening up the economy and by removing these public health restrictions slowly, that if there are an unacceptable number of new cases of COVID-19 in a particular area or across the board, we might need to regress a little bit. We might need to clamp back down a little bit. And of course, there's this tightrope walk between economic well-being, between health, between public safety, with lockdowns, with opening up the economy. This is a bit of a tightrope walk, and I'm not saying you have to choose one or the other. It's a balancing act, and of course we have to get it right. And I'm sure there's a sweet spot, and that sweet spot will likely change with time as there's different burdens of disease in different parts of the country. It's not going to be easy. We haven't done this since 1918. We haven't done this since 1918. And there's a sort of a playbook, but not a real playbook. We sort of know the big picture things. It's how it's implemented is going to be the challenge.
I'm curious about something you said. You said if there is an unacceptable number of infections, you have to wonder in a province like Ontario, where the numbers are higher today than they were yesterday. What is unacceptable? Have we just decided we're done with this and it's over? And is this just dangerous medically? I'm also, if you can follow that with explaining what the particular character of a second wave is that is so threatening.
Sure. So to your first point, I hope we haven't decided that it's done, because it's far from done. And we can decide whatever we want, but this is far from over. In the pre-vaccine era, we're going to be contending with this virus whether we like it or not. And we know what this can do. If this virus is left unchecked, it can spread like wildfire. We know it has a devastating effect on people over the age of 60. And you only can look at Northern Italy, New York, Iran, Wuhan, a few other places where what it looks like when a healthcare system is stretched beyond capacity. The whole point of the lockdown was to prevent that. I don't want to jinx anything. I don't want to get too far ahead, but so far we've done well. We have avoided stretching our healthcare system beyond capacity. And then related to your second point, sorry, can you just remind me what your second point was?
Sure. The second point is you hear people talk about a second wave.
Oh, right.
But the suggestion is a second wave is very different from a first wave. It looks different. It behaves different. Why? And what do we need to be ready for?
All a second wave means is a spike in cases. And we know how this infection is transmitted. We know that if people start mingling together, if they're not adhering to physical distancing measures, if they're not adhering to hand hygiene, we can reintroduce this infection into different places. We know many people have very mild symptoms. Some have no symptoms whatsoever. So that's why it's such a sneaky disease, and that's why it can spread quickly. And we can certainly see a spike in cases. So the key thing here is, do we have the infrastructure in place to rapidly detect these cases so that we can quell them, so we can avoid this rapid upswing in cases again? And I think many parts of the country are prepared for this. I think we need to improve in other parts of the country. But all a second wave will look like will be either a small bump, a medium bump, or a large bump in the number of new cases as we move forward. And so the size of that bump depends on our capacity to detect it and our capacity to respond to it, and the public policy and public health policy that's in place now.
Excellent. So Jean, we were talking about the physicality of work before, but something else is very clearly changing here, which is our culture and how we interact with each other. And when you mentioned that the leaders in companies want people to be back in the office and the employees don't, that suggests right away a break in culture. How do you foster an actual work culture going forward in a corporate world? And does it actually matter the same way?
I think it matters more. I think culture is going to be incredibly important. As we move forward, what we're seeing organizations do is develop codes of conduct and social contracts that are agreed to by both the employers and the employees. So if an employee is going to enter into a physical space, whether it be a retail space or an office space, how are you going to guarantee my safety? How are you going to help me through that? But similarly, employers have expectations around work and productivity if additional flexibility like virtual working is going to have happen and be underway. So employers are working through specific guidelines around things like that. They include expectations around looking out for each other, not coming to work when we're sick. I think traditionally, if that was the case, you may have been seen as not productive, right? A lot of professionals that I know and work with would battle through a cold, would battle through something and bring it into the office. That kind of mindset is going to have to change and be thought through. As you go through that. Yeah, go ahead.
I mean, won't people also then have to be paid sick days in ways they weren't? I mean, a lot of people went to work not just because they wanted to seem productive, but they just couldn't afford not to.
So the interesting thing is, how do you create productivity? So if there is a sick day where someone stays home, can they still be productive by virtually working? And every situation is different, because there are those cases where, you're still able to work, but you probably shouldn't be around someone else. So thinking through those things, what we are seeing as a result of that thought process is changes, some broad-based changes in HR policies. So whether it be around funding and supports for virtual working, expectations around working when you're sick, and a number of other elements, really organizations are having to think through those and a lot of their health and wellness, their mental well-being policies and supports they're putting in around some of the challenges that people have had. So it's causing a heavy review in the HR space.
And Jennifer, while we're talking about changes in the culture of how we work, what about how we live? An audience member is asking a very good question, which is, there it is. How will the risk of virus transmission affect the future of condos and high density living more broadly?
Well, this is a great and really important question. And the good news is we're at a point in this process where we have some data emerging from other places that gives us a very good understanding of how contagion takes place. And some of the key things that we know about contagion with respect to this virus is that it is something that is transmitted in shared spaces where there are shared surfaces. This is why prisons, long-term care homes, food processing facilities have in part been very hard hit. We also know, and this is critical because it goes against some of the very early messaging, we also know that you really can't catch it by walking past someone on the street. And this is very important. It doesn't, in fact, spread outside. There's 318 studies that have been conducted now in China. Every single instance of contagion has taken place in an indoor environment, which is precisely why offices need to change so much, because we share a lot of spaces, we touch the same things. But when you're walking by someone on the street, you're not touching something. There isn't a shared surface in that experience, which is why contagion doesn't take place when you're walking by someone on the street. So what does this mean for dense urban cities? Well, there's another little piece of data here that's critical. Some of the cities in the world that have been best at stopping the spread of the virus are also the densest cities in the world. Hong Kong, Singapore, Seoul. These are cities that rank in the top 10 densest cities in the world, but they put systems in place, things like early messaging and clear messaging. They, whenever someone was identified as having the disease, unlike in Canada, they immediately put them in the hospital. We actually sent people back out into the community, even if they tested positive. That's a very big difference. So the government response has mattered more than urban density. Now, the question of condos becomes really critical. In condos, you're really not at any risk, and we haven't seen outbreaks, so to speak, in condos. The only question is really shared spaces. So what are the shared spaces in a condo? Very similar to an office. You have a foyer and you have an elevator. So I think one of the things we can anticipate is very stringent policies, like have been introduced in Asia already, that limit the number of people getting into an elevator, and also have a mechanism so that you're not touching the buttons in an elevator. It's very easy to do this with technology to ensure that you're not, it's that shared surfaces that is the problem. Party rooms in condos, your condo probably has a party room. They're probably not going to be used as much. And when they are, there's going to be a rigorous policy around cleaning them. What happens to community centers, public pools, public gyms? It's going to be very difficult in the in-between phase before a vaccine to see us sharing those kinds of spaces in cities, precisely because we know it's those indoor spaces where we share surfaces that we know contagion takes place. So I think that gives us a clue. Parks, public spaces, being outside, that's all good. Anytime we have to touch something, whether it's a basketball or whether it's a kitchen utensils, anytime we're touching something, that's when contagion takes place. That gives us a clue as to how our cities will and won't have to change moving forward.
Okay, so two things there I just want to leap on. Thailand apparently has introduced in some elevators foot buttons so that you tap with your foot what floor you're going to. Might be a good idea. But in terms of outside, I just want to clarify with Dr. Bogoch, if there was no threat outside, then I don't think there'd be a recommendation from Dr. Tam that we wear masks in public. So can you give us again an update on, Dr. Bogoch, your sense of the threat outside?
Sure. So just to clarify, Dr. Theresa Tam, the Chief Public Health Officer of Canada, mentioned yesterday that it's recommended that people wear masks. And the key point here is in areas where they might not be able to adhere to physical distancing measures. What's interesting, too, is she said the exact same thing very early on in April as well. I think the key difference between now and early April is now it's a recommendation instead of a suggestion. But the message was conveyed in early April as well. And the key point there is in areas where you can't physically distance. I totally agree that, the risk of transmitting this infection while outside, especially while 2 meters or more apart from one another, ranges from about 0 to negligible. Like, these are just places where people aren't getting the infection. And of course, I appreciate that there's an evolution of our understanding of this infection. We've only known this thing's existed for 5 months. And it's important that our public health policy and our policy and the general recommendations for how we manage this infection evolve in concert with how with our understanding of this infection. We've got to keep up to date. Certainly we need tremendous buy-in from the general public to do things that are hurtful, right? Stay home. Don't go to work. Like, these are hard things to do. They hurt people physically, emotionally, psychologically, financially. We need a tremendous buy-in until we have a vaccine, until we have a durable solution out here. So if we're going to be asking people to do a lot of things that might not be in their individual best interest, we have to keep public policy up to date and smart. And I think, for like everyone else on this call said, we've got to open up public spaces outside. We should open up these green spaces. Of course, we have to do it responsibly. Of course, it doesn't mean, having 100 kids climb around on a playground with a high contact surface. I don't think we're not there yet. But you can go kick a soccer ball around in the playground with your family. If you can do this and adhere to physical distancing measures, the risk of getting this infection is like extraordinarily small, almost. Of course, nothing in medicine and life is 0%, but we're getting close to that.
Okay, thank you. Angus, I have a question for you from the audience here. Do you have a view on the post-COVID effect on inflation, terrifying, given the measures needed to lower capacity thresholds across almost every industry and the impact in the profitability of businesses?
Yeah, I mean, there's certainly tensions on that regard, but I think what's the backstop is that, retailers who are ultimately setting prices are being very careful to be sensible in terms of how they price to consumers. I think we've all seen some of the headlines where a retailer went on the wrong side of that equation and started potentially overcharging. And so, all the retailers I talk to are extremely being careful to price appropriately to consumers and not look to be taking advantage. Now, that being said, there are huge tensions, as you mentioned, to increase costs. Supply chain costs have gotten much higher. Retailers are struggling to stay in stock, and they're accounting for that. Retailers that used to carry 15 variety of flour, they're trying to carry just 3 variety now and be in stock and meet that promise to customers. But it's more expensive potentially to do that. So supply chain costs are going up, and as we all know, labor costs are going up as well. Many retailers have chosen to pay emergency pay to frontline workers. Also, others, and now all, will have to have some investment in cleaning and sanitization. So, just about every retailer is going to be faced with increased costs that they need to manage. I do think the countervailing force for some period of time is going to be holding prices down to be seen to be fair and true to the consumer. And, maybe longer term, potentially as we get out, 6 months, 12 months, 18 months, we may see some of those pressures come off. But right now, no retailer wants to be on the wrong side of raising prices.
So for all of you, I have a question about Canada. Is there a place, is there an industry, is there a business in particular that you are especially worried about? Angus, can we start with you?
Yeah, I mentioned food service earlier. That's certainly one I keep my eye on. I think a lot about small business as well. Large businesses, and we work with a lot of them, they're getting on top of their safety protocols. They're trying to catch up on e-commerce as fast as they can and serve those customers who are now shopping online. It is more challenging for those small businesses to get a website up and running very quickly and have all the site operations and the logistics behind it. They're very challenged to have a flexible labor pool. So we're talking to a lot of retailers that are saying, I'm taking all my store staff and I'm training them to work in the warehouse now, just in case there's a secondary wave or I have to close a store down. They can very quickly now move to a different set of jobs. Well, if you're a small business, a small retailer, you don't have that type of flexibility. And if you lose 1 or 2 people, you're really struggling to operate. So, I think what we've seen is small business has been nimble. They're very close to their customers. They can move fast. They can be responsive, but they will struggle with some of these bigger moves like e-commerce, like labor flexibility, that big retail and big companies are more able to respond to and invest behind.
Jean, what about you?
Yeah, I think all of the sectors have been impacted by this. The one that probably concerns me the most is the energy sector, the oil and gas sector. As we see, certainly all of the pandemic impacts have happened with respect to the workers and safety, but then we're also seeing the commodity price be a challenge. So there will be some fundamental changes that will have to happen in that industry for it to survive and be an economic driver for the country as it has been in the past.
But you're speaking of the country as a whole, but is there a place you're worried about? I can't help think about Alberta when I hear you talk.
Yeah, so I think Alberta has a challenge ahead of it. The oil and gas industry is going to have to transform. What I also know about Albertans is they are extremely resilient. They are very used to changes, related to commodity prices and changes in the health of the industry, and they have a very can-do attitude. So with the right mindset and with that perspective, we can get through this, I think, and support from some of the rest of the country. I think that there are, that they will emerge as leaders in the energy sector with that mindset. But there is a transformation that needs to happen for us to get there.
Jennifer?
Well, I'm really glad to hear Jean say that there needs to be a transformation in the oil and gas sector, because we know it's a sector that isn't consistent with a green economy. It's not consistent with the Paris Accord. one of the good things has been that we have been consuming less carbon during this pandemic. That's actually been a good thing for our health, for our air quality, for moving towards a more sustainable economy. So that sector obviously is going to need to adapt in really significant ways. And the worst thing we could really do as a government, I think, is prop it up. The cities in the world, like Paris, like Milan, like Berlin, that have seen the pandemic and the shift away from driving as an opportunity to create decarbonized cities. Cities where the foundation of transportation and movement, which transportation, by the way, is the #1 driver of our greenhouse gas emissions in North America, according to NASA. So this idea of being able to shift the way we move in our cities to be more sustainable, focused on transit, cycling, and walking, is an incredible opportunity that we can now validate as a result of this moment that we've had where we've not all been immersed in a long commute. And we've seen, Los Angeles, there's phenomenal data. Los Angeles has the cleanest air that it's had in 40 years during the pandemic. There's also phenomenal data that's coming out right now that is linking contagion and the worst cases of COVID-19 to bad air quality because it's a respiratory illness. So the link between health and decarbonizing our cities is just gargantuan, and we're presented with a phenomenal opportunity. The other industry that I think warrants mention, because it goes back to creating walkable cities, is our Main Street retail. And I'm deeply concerned about having a strategy for the in-between phase and communicating that strategy to our Main Street retailers. A survey came out yesterday that indicated 2/3 of Main Street retailers in Toronto are not confident that they can survive another 6 weeks of being closed down. It's not surprising. These are one-off retailers who have pretty tiny margins to begin with. They don't have a lot of resilience. To just suddenly go dark for a few months is a massive hit, particularly over the summer, where many of them may make most of their earnings. So putting strategies in place to ensure that our Main Street retail and our restaurant industry is going to survive this as much as possible. We already know there's closures that are happening, but so that it's just not totally decimated. And I'm not talking here about subsidies for the rent, because that's a stopgap measure. We need much bigger strategies, things like transitioning how we use public space so that restaurants can have alfresco dining like they've proposed in Lithuania. They've taken over the roads to allow alfresco dining so that people can dine and socially distance in the in-between phase before a vaccine. Those are the kinds of solutions that we need to plan for, and we need to identify how we're going to execute them immediately so our restaurants don't completely disappear, and we're on the cusp of seeing that.
Okay, thank you. I was a bit surprised. I kind of thought somebody would say long-term care, because it seems to be a disaster now. So Dr. Bogoch, I have a feeling that's where you're going.
Long-term care. Yeah. No, I mean, it's been absolutely tragic watching the epidemic unfold in Canada and see how vulnerable our long-term care institutions truly are. And, it's not nice to say, but it truly comes to no surprise to many of us in the healthcare field and in other related fields. We've known about these vulnerabilities for some time. There's been some lip service paid toward, improving these facilities and the care that's provided in these facilities. And, it's sad that it takes a pandemic to really identify these vulnerabilities. And, if we look at, just the metric of deaths, look at deaths in Canada related to COVID-19. Across the board, about 80-ish%, in some places 90% of all the deaths are in long-term care facilities, depending on the region that you're in. This is tragic, and obviously, it was avoidable. It certainly was avoidable. So I think that industry, if we're going to call it an industry, but that sector needs to be it needs to have significant improvement. There is a bit of a silver lining. British Columbia was the first to really enact some smart policy to decrease the likelihood that infection could be introduced and then transmitted in those facilities. They helped out with the workers of these facilities. They've developed policy that protects the people that live in those facilities. And across the board, we've seen that adopted. So there are some helpful solutions to this. I think the key thing here is, can we and will we continue to do this moving forward in the next phases and well beyond? And well beyond. And just one other quick point while I've got a second here. I think my concern moving forward too is, when we talk about different industries, in the short term, like in the real short term, I'm just concerned about any industry where people are not able to maintain physical distancing measures. We can list them off, but one of the classic ones that have come up is meat processing plants. We've seen outbreaks in meat processing plants, but we can think about dozens and dozens of other places where people are, just by the nature of the type of work that needs to be done, people are elbow to elbow. And these are going to be very challenging in the near future as we move forward. They might not be as challenging as we move farther ahead in the future, hopefully as we see the burden of this infection go down in many settings. But certainly they're very vulnerable.
Okay, thank you. I just want to get to another question, if I may. And Jean, I think we'll put this one to you, if you don't mind. With virtual work becoming a more permanent feature, what role should government play to ensure internet equity in all parts of Ontario and indeed the country? This is a huge deal.
Yeah. So absolutely. I do think governments should look at this much like governments in the past have looked at infrastructure around railways, right? To bring economic development and success and prosperity to different areas of the country. They've looked at it from an energy perspective. So providing, health and heating and things, technology and internet is our next wave of challenge with respect to prosperity and bringing prosperity across all of the country. So whether it is, whether it's traditional networks around Wi-Fi or if it's satellite, governments should be looking at that and how they can provide that equality to different parts of the country to develop and promote that economic prosperity so that we can be successful as an entire country.
Okay, thank you. No one has asked us how we're going to pay for all this, but I'm sure that question will be asked further down the road. We have just a few more minutes left, so I'd really like to be able to leave people with something that they can imagine that is better. So if we can do a whip around with all of you, if you can offer us some concrete, stealable ideas that you have heard from other parts of the country or other parts of the world that you think are feasible to put into place. And since we have Eugene here, why don't we start with you?
Yeah, so there's lots of tactics. I think those social contract pieces, using technology to coordinate ins and outs of work, and really using scheduling systems and a lot of the technology that is there out in the market for a different purpose can be very, very helpful. In all of it, you mentioned the different pieces where, there's buttons on the floor or whatever. I think my very best advice for employers as they go through is to be very flexible. So to have scenarios, make sure you are planning and building on a number of scenarios. So as we talked about, planning for hotspots. If you are an employer that has different locations, either within the GTA or across Canada, across the world, what happens if one of them goes down? And then what happens if we do see another wave of this come through? So having a very clear scenario around those things. What happens if your technology doesn't work? What happens if that reconfiguration in your elevator doesn't work? And being very clear and prepared for things to fail is my best advice there.
Fair enough. Angus, the best idea?
Yeah, I think, two things, two kind of buckets of ideas. One is, our customers are telling us that they want to feel safe when they go out shopping. 60% of them have said the reason why I'm not going out shopping as much is actually I'm waiting till I feel safe when I shop. So the kind of forward-thinking retailers are communicating to their customers through messaging, signage, and also being very visible about the actions they're taking around sanitization and social distancing, showing customers they're serious about it. I think that's been really important as customers start to get back, that we are doing it. We have signs around it. Our people are taking it seriously, and that's actually getting people to start to feel comfortable that measures are safe to come back. I think the second piece is around, really listening to your customers and how they're changing, how they're shopping. So, in this period of lockdown, 10% of customers tried shopping for groceries online that had never tried it before. And so watch those customers, understand, is that a permanent behavior that they want to keep? And we're hearing up to a third or more of those customers are saying, yes, I want to actually keep shopping online. So watch how your customers' behaviors are changing. And we're seeing the leading retailers really keeping a close eye on what's just temporary for the lockdown and what's going to stick and change in behaviors. And I think that safety and that e-commerce are going to be two pieces that you can focus on.
A tip of the hat to all the ingenuity that's out there. I was reading about Lithuania this morning where in order to get people to go back to restaurants, they put mannequins. I think we've seen a number of places do this, mannequins in the seats where people can't sit. But then they thought, what if we put them in the latest designs of our local fashion designers? So while people eat, they can look at the new designs and then buy them on their way out. So people are very clever. Jennifer, what do you like out there?
Well, I think that one of the amazing things that's happened to many of us is that we've sort of been stopped in our tracks. We're at home, our children are at home. We're not rushing our children out the door in the morning. We're not rushing out the door ourselves in the morning. For me, I've noticed birds I've never noticed before. I'm not a bird watcher, but I frequently have been sitting at my window and suddenly noticed a cardinal or a blue jay or an oriole. And it's been shocking to me because, quite frankly, I've simply been too busy to be paying attention. But with the end of the commute, it's opened up a very different way of living in our neighborhoods. And I think the most powerful idea that I've seen out there comes from the mayor of Paris, who has accelerated a plan to create 15-minute neighborhoods across all of Paris. Buying into the dream or the vision that if we add just enough density and just enough of a mix of uses in every single neighborhood, that we will be able to do more things on foot and more things based on cycling. Rather than getting in a car to go get our haircut, we can walk to get our haircut. Rather than getting in a car to go to the doctor, we can walk to go to the doctor. So this idea of the 15-minute neighborhood and being able to live more in our neighborhoods, which is a much greener approach to city living. It's a phenomenal opportunity that I think for many people who really haven't thought that much about neighborhoods, they've started to kind of experience their neighborhoods, even get to know their neighbors, clanging pots in the evening or bumping into them on the street and having a social distanced conversation in a way that they didn't in the past. And I think that opens up a whole new possibility about a very different way of living that is simpler, that much less carbon intensive, that is more community oriented, and that can really keep the critical infrastructure like transit, which is going to continue to be critical infrastructure, keep that infrastructure for the people who need it most, the essential workers who have long distances to travel, who need to be on transit. Let's prioritize that infrastructure for those workers who are sustaining all of us today. So I think that 15-minute neighborhood is a phenomenal possibility that emerges as a result of this pandemic.
Excellent. With 1 minute to go, Dr. Bogoch, we started with you. It seems appropriate to end with you.
I'm pretty excited about some of the medical innovations that are going to be coming out in the next, month to few months ahead. We're really sitting at the edge of having some phenomenal results available, looking at new treatments that will be effective for COVID-19, drugs that we can use perhaps to prevent COVID-19 in those who are exposed. And of course, early vaccine research is starting to roll out as well. This is exciting stuff. This will change how we live with this virus, how we treat this virus. This will change how we manage risk and how we manage individuals. And I think this is going to change how we live in the short term, in the medium term, and also in the long term. A lot of what we're talking about really hinges on durable solutions, and durable solutions to safety involve mitigating risk if people are infected, preventing infection with medications and with vaccines. And we're coming close. I mean, we're going to have some very impressive results coming out soon. I hope they're positive. They might not be, but these trials are ongoing and they're coming to a conclusion soon. So we'll know more in the weeks and months ahead.
All right. Thank you very much, Dr. Bogoch. All of you, I really appreciate a chance to speak with you. I've written down about 12 story ideas here. So I'm going to hand it over to Nikki now.
Wow, big gulp, everyone. There's so much that you shared, so much for us to take in, so much for us to think about, and so many thank yous. Well, thank everybody for participating, to the panelists, for your thoughts and your time, to Adrienne for being with us today, and for the fire alarm for not really causing us too much of a headache, except maybe for you. Obviously, we want to thank PwC for sponsoring this event, to our viewers who came to watch us virtually in a different format and embraced it. We want to thank you. We want to thank our AV supplier, Van Valkenburg Communications and LiveMeeting.ca for making today possible. And we've got more to come. We hope that you'll join us on May 28th as we honor a panel of frontline workers in the same format. And we hope that you all have a really great day. Thanks for joining us.
Thanks so much.